I'm Dr. Chrissy Elrod, and I'm back to break down big concepts like medical trauma and PTSD for providers and for people who've experienced it. Today, I want to talk to you about one of the most dangerous side effects of medical trauma and PTSD, and that is medical avoidance. Medical avoidance is when we shy away from necessary medical care due to the anxiety, fear, or traumatic experiences that we've had around this medical care. Avoiding medical care can lead to a delayed diagnosis, worsened conditions, missed opportunities for timely interventions. So something that might have started out small that could have been easily treated with affordable medication over time builds up and gets worse and ultimately leads to a big catastrophe that could have been maybe prevented if someone had come into the doctor earlier. I'm sure we've all heard stories of people who don't go to the dentist for up to 10 years. That was my dad. He just didn't like it, found it to be uncomfortable, so he just didn't go. Eventually, he ended up with a pain in his mouth, and of course, it comes out he needs a root canal, some other dental work, and all of this could have been avoided by just going to the first simple appointment and getting the preventive treatment that was needed. This is why medical avoidance is so dangerous, because we've already had a negative experience with medical health providers. So the logic in our brain is, I don't want to go back to that. I don't want to know if anything bad is happening to me because I don't want to have to deal with all that treatment again. I just don't want to do any of this anymore. Over time, this really builds up and can create a huge health problem and ultimately make the situation that we're trying to avoid even worse. What can we do to try and overcome medical avoidance? One, we want to just acknowledge our fears. It's okay to feel anxious and scared of going to the doctor. A lot of people feel that way who haven't had traumatic experiences. And if you have, I completely understand that you don't want to go back anymore. It feels like a really dangerous place. But acknowledge that. Bring it up. You're not the only one who's feeling this way. You can seek support. Reach out to trusted friends, family, or support groups who can help give you some encouragement and understanding during medical visits. They can help provide that support that you need. Coping skills, distraction, talking to you, helping to listen to the doctor's appointment so that they can explain to you what happened afterwards if you're so triggered that you just really aren't present to hear. Another important thing is open communication. Tell your doctors what's going on. Discuss your concerns openly with your healthcare providers. I would tell them how I felt. I would tell them I'm anxious, I'm worried, I'm freaking out right now. My blood pressure is high because I don't want to be here. Let them know what's going on with you so that way they can offer reassurance, they can answer any questions that you have, they can maybe get ahead of some of those fears that your brain is taking you on a ride with that may not even be accurate or true. So get that information from your doctors about what is happening. They can also adapt their approach to help make you more comfortable. And this is another thing that I really want to encourage because you are in the power position when you are meeting with your doctor. I know it doesn't feel like that. It doesn't feel like that to me because they are the expert in something that's so urgent and important, like saving my life. But I'm the expert in my body and I can talk to them about how they can adapt their style. I can't necessarily run the show because I'm not the doctor. I can't be my own doctor, but I can tell them what's going on, tell them what's making me uncomfortable, and expect that they would do some reasonable accommodations to help make me feel okay about what's going on and definitely be very invested in not making things worse. I would hope that they are humble and don't take offense to any mention of medical trauma. There's no blame or shame here. It's really about getting the best medical treatment that we can. I really recommend therapy or counseling so that you can seek support from a therapist who's experienced in trauma and anxiety. They can guide you through these coping strategies and provide a personalized assistance, as well as maybe support you and help you practice like what to say to your doctors or how to ask the questions that you want to ask. Another great strategy for medical avoidance is relaxation techniques. Practice deep breathing, try some meditation or visualization activities to manage your anxiety before your appointments. There's a lot of really good apps for this, a lot of good videos just here on YouTube or on the internet. Try some out. If you have questions about it, I have a more in-depth video on apps and mindfulness and meditation coming up, so stay tuned for that. Remember, knowledge is power, so educate yourself about your procedures, the risks, the benefits. Understanding the process and your procedure can really help alleviate some anxiety anxiety and empower you to feel like you're in control of what's going on and what's going to happen in your life. Remember, your well-being is absolutely paramount, so share this valuable information with others who may need it. And if you have any questions, please leave them below. I love answering questions about medical trauma. I love talking about it. I love teaching about it because unfortunately I experienced it. So I'm here to take big concepts like medical trauma and PTSD and break them down into bite-sized pieces for professionals and people who've experienced. Thank you so much. Have a great day.